Last year, nearly 38 million aesthetic procedures were performed around the world. 38 million. Let that sink in. And according to surgeons themselves, one of the most common reasons patients are walking into the consult room is to fix something that someone else already did to their face. I'm going to say that again. A significant chunk of the people sitting down across from plastic surgeons right now aren't coming in because they want something done. They're coming in because they want something undone. So, the question I want to start with today, the honest one, is how do we get to a place where one of the fastest growing segments of aesthetic medicine is correcting aesthetic medicine? Welcome to Honestly. I'm Dr. Chris Lee, board certified plastic surgeon, aesthetic medicine expert, and apparently the guy that every dinner party who gets cornered the second someone finds out what I do for a living. The premise of the show is simple. You know that feeling when you really want someone's honest opinion about something and you preface it with the word honestly? Like, honestly, should I get this done? Or honestly, does this look weird? That's the show. Every episode is the answer I'd give to a close friend who came to me with that question. No hedging, no legal disclaimers dressed up as medical advice, just real answers. I practice out of Boston, Chestnut Hill specifically, and I've been doing this long enough to have seen every trend come and go. Every miracle treatment get overhyped and then quietly disappear, and every version of what happens when patients get information and when they don't. Today is our inaugural episode, and I wanted to start with something I think about literally every week in my practice because it affects almost every patient I see in my clinic, and especially out in the celebrity world, whether they know it or not. We're talking about the over-operated, or really the over-procedured face. The look that screams, "I've had work done," even when the person paid a lot of money specifically to not look like that. Specifically, I want to talk about two things that are tanking results across the industry right now: the pillow face filler problem and the pooled windswept facelift. And then I want to tell you what genuinely good results actually look like and how you find the person who can give it to you. So let's get into it. Let's start with filler, because this is, and I say this as someone who injects filler regularly and thinks it's generally one of the most powerful aesthetic medicine tools that we have when done right. This is a situation that has gotten completely out of hand. Hyaluronic acid filler procedures increased by over 5% globally just in the last year. We're now doing over 6 million filler procedures worldwide annually. 6 million. And the number of providers doing them has exploded along with it. So, what went wrong? Here's what happened. Filler is easy to learn in a sense that the technical barrier to injecting someone is pretty low. You can take a weekend course, you can learn the anatomical landmarks, and you can put it in a needle and push it. That part, not that hard. What's hard, genuinely technically hard, is having the artistic and anatomical judgment to know where not to inject, how much is too much, when to stop, and critically, what face you're creating 5 years from now and not just what it looks like walking out of the appointment. And that judgment, you don't get it in a weekend course. You get it from years of studying facial anatomy, from understanding how filler moves and migrates over time, from seeing what happens when you over inject the cheeks, which, by the way, is the number one cause of what we call pillow face. That puffy, slightly alien, overinflated look where someone's face just looks like it's been upholstered rather than rejuvenated. Which gets me to my next segment. I want to introduce a segment I'm going to do in every episode. I'm calling it the Honestly Scale, where I rate something from 1 to 10 on how honest the industry has been with patients about it. So not how I feel about the actual procedure, but how I feel about the honesty of the marketing behind the procedure. 1 would be a total lie, and 10 is completely above board. The filler industry's honestly score on long-term results and cumulative over-injection, I'm going to give it a 4, maybe a 4.5. The marketing is all about natural enhancement and subtle improvement. The reality, when you look at some of these patients 10 years into regular filler, is genuinely concerning. Filler migration, facial distortion, volume in places it was never meant to be. And the patient doesn't even know it's happening incrementally because they're looking in the mirror every day, not seeing those changes over time. Part of this is due to deceptive marketing, and part due to the patients that just aren't ready for plastic surgery. But I think the real problem is med spas or injectors that refuse to accept that there's only so much filler can do before someone just needs surgical correction. Many providers out there want to sell you something when you come through that door. And if their premium product is filler, well, honey, you're going to get some filler. When all you got is a hammer, then every problem becomes a nail. Now, here's the thing. I am not anti-filler. I'm anti-bad filler. Good filler in the right hands and at the right volumes in the right places is remarkable, like stunning, and can really be a good tool to use. The key most people miss is restraint. The best filler result is one where nobody can tell you had filler, where you just look well rested, healthy, yourself, just better. And along with restraint is knowing when filler is just not gonna cut it. And you need to think about referring to a good surgeon. For any injectors out there listening, this advice should be tattooed on your hands because at the end of the day, an unhappy paying customer is always more of a headache than a happy no sale customer. The hallmark of overfilled faces is specific. The cheeks are too high, too round. There's a puffy transition between the cheek and the lower eyelid. The lips lose their natural definition, and the whole face starts to read as an inflated rather than youthful. If you're looking at someone and thinking she looks amazing, that's good filler. If you're thinking she looks like she had something done, possibly at Mar-a-Lago, that's a problem. Now, the real question, would I get filler? Yes, absolutely. I think a small amount of strategic filler in the cheeks, piriform fossa, a touch in the temples, maybe a little bit for lip support along the vermilion border, done conservatively over time is one of the best investments someone can make. Under the eye bags, phenomenal results when done right and safely. Would I ever let someone overfill my cheeks to the point where my face looks like a different shape than it actually is? Absolutely not. Never. And I want patients to feel empowered to say that word to their injectors. No, no more. We're done today. Say it with me. No more. We are done today. Okay. So now that you know what to say to your med spas, let's talk about facelifts. Because if filler problem is too much volume in the wrong places, the facelifts problem is too much tension in the wrong direction. Facelift procedures are actually up. They rose about 1% in 2024. And what's interesting is the demographic is getting younger and younger. Surgeons are now seeing patients in their late 30s and 40s wanting facelifts, which a decade ago would have been unthinkable. The trend toward earlier intervention is real, and I think it's actually smart. Smaller procedures, less recovery, more natural results, less of a drastic change, but only if the technique is right. Now, we've all seen bad facelifts. It's the windswept, pulled back, tight look, you know, where you have the lateral tension on the corners of your eyes, on the corners of your mouth, uh, too high on the hairline, the ears that look like they're being dragged back. This is the facelift result that most people are afraid of, and honestly, rightfully so, because it happens, and it happens more than the industry who would like to admit or would like you to know. But there's a reason for it, and here's why it happens. There are basically two type of facelift techniques. The older is much simpler, and it just addresses the skin and pulls the skin back. Um, it's faster, it's technically easier, and it produces a good result that looks good immediately. Tight, lifted. But it looks operated because the skin wasn't sagging in the first place. Skin follows the underlying structures of the face, the muscles, the aponeurotic system, When you just pull the skin, you're fighting gravity and you're fighting those underlying structures. And unfortunately, gravity is going to win, and usually pretty quickly within a few years. Now, the deeper approach, what we call a deep plane facelift or even a smash lift, actually addresses the structural layer beneath the skin. It's called the fibromuscular layer, called the SMAS. Uh, and when you lift it and reposition that layer, the skin follows naturally and without tension. The result is fuller, more dimensional, longer lasting. It looks like you aged backwards rather than had surgery. So, why do patients still end up with the pulled look? For a few reasons. One, not every surgeon is trained and comfortable with the deep plane technique or high smash technique or whatever technique you want to go with. It's a harder operation. It takes longer. It's a longer learning curve. It's, there's more risk to the operation. So, for all those reasons, it can be challenging. Two, patients sometimes push for a result that's actually too aggressive for their anatomy, and a surgeon who isn't confident enough to push back will give them what they ask for. Three, some patients genuinely like that pulled look. I don't know why. I'm not going to tell you your aesthetic is wrong, but if you're coming to me asking for natural, I need to explain why what you're pointing to in that Instagram photo is not, in fact, natural. So, brings me to my honestly scale for how the facelift industry markets technique and results to patients. I'd give it a 5. There's more transparency here than in the filler world, but there's still a significant gap between what surgeons say they do and what they're actually doing technically. Deep plane has become a marketing term that some surgeons use loosely and don't actually get into the planes that they're supposed to be getting to, which lead to results that do not last as long. And on top of that, social media can be very deceptive when it comes to results that can be attributed to the facelift and results that are really helped by good makeup and lighting. Even the best facelifts out there in public, the Kris Jenners, the Lindsay Lohans, are helped by lots of makeup, fastidious skincare, and multiple procedures that keep a good result, like lasers, microneedling, facial peels, light therapy, and a truckload of skincare. My advice is ask your surgeon to explain specifically what layer they're working in and what their revision rate is. Those two questions will tell you a lot about what their practice is. So, would I get a facelift? This is a question I get personally more than almost any other. And honestly, of course, when the time is right, not now. I'm not there yet. I hope, but absolutely, a well executed deep plane facelift done at the right time by the right surgeon is still the most transformative, long lasting thing you can do for your facial aging. Nothing else comes close. Not filler, not lasers, not skin tightening devices. If I'm 65 and my face is bothering me, I'm getting a facelift, full stop. Now, all those other things are useful to keep your skin quality up, to keep your volume up. But again, a facelift, bar none, is going to be much more effective in giving you that rejuvenated look. Okay. I've spent a lot of time telling you what bad looks like. Let me tell you what good looks like, because there's a reason it's harder to define. And it's actually kind of profound. The best aesthetic results are invisible, not because nothing was done, but because what was done in harmony with the patient's natural anatomy, that the results just look like the best version of themselves, of them. Think about the last time you saw someone who you thought was just effortlessly attractive, healthy skin, rested eyes, defined jawline, natural proportions. You probably weren't thinking about what procedures they had. And that's the goal. Results should look natural, just younger. Natural results share a few characteristics. First, the proportions are preserved. The distance between the eyes, the width of the nose, the relationship of the lips to the chin. A good surgeon works within those proportions rather than overriding them. Second, there's dimension. Faces have shadows and highlights and movement. When you overfill and over tighten, you lose that dimension. Faces look flat, waxy, expressionless. Third, it looks the same from every angle. Bad work is often detectable from a specific angle, a profile view, a three-quarter view that reveals the tension or the volume distortion, and good work holds up everywhere. So you shouldn't have the right angle to look at. It should just be everywhere. Now, the most important thing you can do before choosing a surgeon is study their before and after photos, obviously. But, and here's the clincher, you can't just pick the hero shots, not the 3 perfect patients front and center on their website. The full gallery, and specifically look at the afters, not for what has changed, but for whether the person still looks like themselves. If the afters look like the same person but better, that's a green flag. If the afters look like a different person altogether, or if everyone's afters start looking the same, that's a serious red flag. The other thing I want to talk about, and I'm going to be transparent here because it matters, is how you actually choose a surgeon. And I'll be honest about my own position in this conversation. I'm almost 4 years into my practice. I'm not the guy with 30 years and 10,000 cases. So take what I'm about to say, knowing that I've thought about it from both sides. Numbers matter. Experience matters. Reps matter. If someone has done 5,000 facelifts, they have seen things that someone who has only done 500 hasn't. And that's real. And I'm not going to pretend otherwise because that's crazy. But here's what I've also learned, and what I think gets completely lost in how patients are told to evaluate surgeons. Volume is not the whole story, not even close. The surgeon with the most cases is not automatically the right surgeon for you. What you're actually looking for is someone whose aesthetic sensibility matches yours. Someone whose results, when you study them honestly, look the way you want to look. Someone who has built a practice and a team around making sure you are taken care of, not just in the operating room, but through the recovery, through the hard days, and when you're swollen and second guessing everything that you've done, through the follow up 6 months out. Because here's the thing that nobody tells you, the relationship is at least a year. And a surgeon who has done 10,000 cases, but whose team doesn't return calls, whose nurses are rotating every 6 months, whose follow-up process is a form letter, that person may technically be more experienced, but the experience you have as a patient might be worse. There's also something I can only describe as the it factor. And I know this sounds unscientific, but hear me out. Some surgeons just see faces differently. They have an artistic instinctiveness that isn't purely a function of years in practice. It's taste, it's proportion, it's the ability to look at your face as a whole and understand not just what to change, but what to protect. And on top of that, an adeptness at the surgery itself, to see the tissue planes, to safely and completely do the job. That quality doesn't always correlate with seniority. So my honest advice, yes, obviously, look at the credentials. Yes, look at experience and volume, but also look at, do you trust this person? Do they listen to you? Does their team make you feel like a priority? Do their results look like a version of yourself that you're trying to reach, not just an impressive result in general? Does his or her team elect to have surgery with them? And when you sit across from them, does something in your gut say, yes, this is the person? That last one matters probably more than most patients give it credit for. You got to trust yourself, and you got to trust your gut when it comes to someone who you're going to be trusting to take care of you and your face for the next at least year. And here's what I call the honest checklist. 5 questions that I promise you will immediately separate a surgeon who knows their craft from one who doesn't. Question 1. What would you do if this were your face? Not what can you do, not what are you trained to do. What would you actually do to your own face? A good surgeon has an honest answer to this. And if it's more conservative than what the patient came in asking for, that's usually a good sign. Question 2. Can I see photos of patients 1 year or more out? Anyone can show you a good 3-month result. Show me what your work looks like when it settles, when gravity is re-engaged, when the swelling is completely gone. Then I will judge what your result looks like. Question 3. What's your revision rate for this procedure? Don't accept a deflection. A good surgeon knows their numbers and isn't afraid of that question. So go ahead and ask it. Question 4. What's the one thing about my anatomy that makes this more complicated or more difficult? This tells you that the surgeon has actually analyzed you as an individual and not just selling you the same procedure they sell everyone. And question 5. If I decide I want less than what we discussed, will you support that? This is a consent question. The answer should always be yes. If there's any hesitation, get out the door. At the end of the day, this is your face. It is a decision that needs to be made between you and your surgeon. And you need to know that that person that's sitting across from you is going to listen to you when it comes to those heavy decisions. All right. Now we will move on to our question answer section called Ask Me Honestly. And I've got some questions this week. So let's dive into them. All righty. So all right. Here's the first question. I'm 48 and my face is starting to bother me. My friend had a facelift at 45 and looks amazing. My dermatologist says I just need more filler. Who do I listen to? So, honestly, your friend with the facelift is winning this argument. Here's the thing. Filler and facelifts solve different problems. Filler addresses volume loss. A facelift addresses structural descent. And the mistake I see constantly is surgeons and injectors using filler to try to compensate for tissue that has actually fallen, when what the face needs is to be repositioned, not inflated. At 48, if what you're seeing is jowling, neck laxity, and a loss of jawline definition, that is a structural problem. More filler is not going to fix it and can actually make the face look heavier and older if it's not adding the right kind of volume in the right places. So my honest advice is get a consultation with a plastic surgeon who can evaluate your structure and not just your volume. The other thing to remember is that every patient is different. Just because your friend had a facelift at 45 does not mean you necessarily need one. But if you're even thinking about it, then you should talk to the right people. And that's not a dermatologist, unfortunately. That's an actual plastic surgeon. All right, let's move on. All right, here's a good one. I had lip filler 6 months ago, and now my lip looks weird. Kind of puffy above the lip line. My injector says it will dissolve on its own. Is that true? All right, so we've all seen this. And the honest answer is it depends. And probably not going to dissolve as quickly as you want it to. What you're describing sounds like filler that's been placed too superficially or too close to the vermilion border, so you lose some of the definition of the lip line. And it's now causing what we call the shelf or duck look. Hyaluronic acid filler does eventually metabolize, but the timeline varies pretty widely. It can be 6 months or it can be 2 years, depending on the product, the placement, and your individual metabolism. It's possible, and there are some studies that show that filler lasts much, much longer than we believe. So if it's been a while and it's bothering you, you really don't have to wait. Hyaluronidase, the enzyme that dissolves HA filler, is safe, effective, and can be done in one appointment. Don't let anyone talk you out of something if you're unhappy. It's your face. So do what makes you happy. And if that means starting it over or revising it a little bit with hyaluronidase, go for it. All right. Question 3. How do I know if a surgeon is actually good or just good at Instagram? This is my favorite question, and I want more people asking it. The honest answer, Instagram is a highlight reel. No surgeon posts their complications. Nobody posts their revisions. Nobody posts the patients that came back 3 years later and wanted something fixed. What Instagram can tell you is whether a surgeon has aesthetic sensibility. Do you like the way their results look? Because that's what they think a good result is. Are the results they're showing consistent with what you want? That's good stuff to look at for Instagram. But Instagram can't tell you technical skills, complication rates, or how they handle difficult situations. So, my rule, use Instagram to build your short list, then go meet them. In the consultation, watch for whether they spend more time talking about themselves or examining and listening to you. Watch for whether they offer you options or just sell you what they do. And watch for whether they are able to tell you no. The surgeons who say, actually, I don't think you need that, or I think that's too aggressive for your anatomy. Those are the surgeons you want. Someone who can tell you when to stop. Okay, here's the one thing I want you to leave today with. The best aesthetic result, whether it's filler, surgery, anything, is one where you look in the mirror and think, that's me. Not a better version of someone else, not a younger version of a stranger, just you, but the version of you that you want to see. If the person you're working with can't articulate how they're going to get you there, if they can't explain what they're doing and why in terms that respect your intelligence, then they're not the right person. So keep looking. All right, guys, that's it. Episode 1 in the books. If you've got a question you want me to answer honestly, genuinely, the answer I'd give a close friend, then send it over to me. The link is in the show notes. DMs are open, and I read everything. I'm Dr. Chris Lee, and this is Honestly. See you out there.